Welcome, dear viewer. We're so glad you're here. This space is created just for you, to bring clarity, comfort, and knowledge that truly matters for the health of your loved ones. So, take a moment to settle in, find a comfortable seat, breathe easy, and let your mind relax. As you watch, allow the information to unfold gently, step by step, in a way that's clear and easy to follow. By staying with us until the end, you'll gain insights that could make a real difference in caring for your family. This isn't just another video, it's a warm conversation, a guide, and a companion on your journey to better health. Now, let's begin together. Here are some striking and recent global statistics showing how significant childhood pneumonia is. Pneumonia is the single largest infectious cause of death in children under 5 worldwide. World Health Organization +2 Johns Hopkins Public Health +2 It accounts for about 14% of all deaths of children under 5, killing around 740,180 children in 2019. World Health Organization That's over 700,000 deaths each year in under 5s, including around 190,000 newborns. UNICEF data +1 globally, a child dies from pneumonia roughly every 43 seconds. UNICEF data +1 incidence is also staggering, over 1,400 cases of pneumonia per 100,000 children per year, with much higher incidence in South Asia, is almost equal to 2, 500/100,000, and West and Central Africa, is almost equal to 1, 620/100,000. UNICEF data. Childhood pneumonia begins when germs, most often bacteria or viruses, enter the body through the nose or mouth. Normally, our airways have defense systems like tiny hairs and mucus to trap and clear invaders. But when these defenses are overwhelmed, the germs travel deeper down the breathing tubes into the lungs. Once inside, they settle in the air sacs, called alveoli, where oxygen normally passes into the blood. The body's immune system reacts strongly, sending white blood cells and fluid to fight the infection. This battle causes the air sacs to fill with pus and fluid, making it harder for the child to breathe and for oxygen to reach the body. That's why pneumonia leads to cough, fast breathing, fever, and sometimes chest pain. In children, whose immune systems are still developing, this process can move quickly, turning a simple infection into a dangerous lung illness if not recognized and treated in time. Pneumonia in children can be caused by either viruses or bacteria, and the differences matter. Viral pneumonia is usually more common, especially in younger children. It often starts gradually with cold-like symptoms, runny nose, cough, low-grade fever, and the breathing difficulty builds up slowly. Antibiotics do not work against viruses, so treatment is mainly supportive with rest, fluids, and oxygen if needed. Bacterial pneumonia, on the other hand, usually strikes more suddenly. A child may develop a high fever, chills, rapid breathing, chest pain, and sometimes cough with yellow or green mucus. Because bacteria are the culprits, antibiotics are the key treatment and can save lives if started early. While both types cause inflammation in the lungs, the major differences are in speed of onset, severity of fever, type of cough, and response to antibiotics. Recognizing these patterns helps doctors choose the right care quickly, which is crucial to protect a child's lungs and overall health. Children are more vulnerable to pneumonia than adults for several reasons. First, their lungs are smaller and still developing, which means they cannot hold as much oxygen. Even a small amount of infection or fluid can quickly interfere with breathing. Second, their immune systems are not fully mature, making it harder to fight off germs effectively. Third, young children have narrower airways, so swelling or mucus can block airflow more easily. Poor nutrition, which weakens the body's defenses, and exposure to smoke or crowded environments also increase the risk. Because of these factors, a simple cough or cold in a child can progress rapidly into pneumonia. That's why early recognition and prompt treatment are so important, to prevent a minor infection from becoming a life-threatening illness. When germs like bacteria or viruses enter the lungs, the immune system's job is to attack and clear them. In a strong immune system, white blood cells rush to surround the invaders, release chemicals to destroy them, and then heal the inflamed lung tissue. But in young children, the immune system is still immature. Their white blood cells are fewer, slower, and less experienced in recognizing harmful germs. This delay allows the germs to multiply rapidly, spreading deeper into the lungs. As the body struggles to catch up, fluid and pus fill the tiny air sacs, blocking oxygen flow. Because their lungs are small, even a small infection can cause severe breathing difficulty. In short, weak immunity gives germs the upper hand, turning a minor infection into pneumonia that can quickly become life-threatening. In the earliest stage of childhood pneumonia, the signs can look very similar to a common cold. The child may develop a runny nose, mild cough, and a low-grade fever. At this point, the infection is just beginning, and germs are settling in the airways. Because the lungs are not yet badly affected, breathing may still appear normal, and the child may continue to play or eat fairly well. This is a critical phase, because the illness can either stay mild or progress deeper into the lungs. Parents often mistake these early symptoms for a harmless flu or cold, which delays care. Recognizing that persistent cough and fever could be more than just a cold is the first step in stopping pneumonia before it becomes severe. In stage 2, pneumonia becomes more noticeable and concerning. The child's cough worsens, often becoming deeper and more frequent. Fever rises and doesn't settle easily. One of the most important warning signs is fast or labored breathing. The body is working harder to get enough oxygen because infection and inflammation are spreading in the lungs. You may notice the child breathing faster than usual, flaring their nostrils, or even using extra chest muscles to pull in air. At this stage, the illness can no longer be mistaken for a simple cold. Medical attention is crucial, because timely diagnosis and treatment, whether supportive care or antibiotics, can prevent the pneumonia from advancing to severe, life-threatening stages. In stage 3, pneumonia becomes dangerous and life-threatening. The infection has filled large parts of the lungs with fluid and pus, leaving little space for oxygen to pass into the blood. The child now struggles to breathe. You may see rapid, shallow breaths, chest retractions, or wheezing. A critical sign is when the lips, tongue, or fingertips turn bluish, showing that oxygen levels are dangerously low. The child may also appear very weak, tired, or unusually sleepy, as the body runs out of energy from the constant fight for air. At this point, home care is no longer enough. Emergency medical treatment, oxygen support, and possibly hospitalization are urgently needed. Recognizing these severe signs quickly can mean the difference between recovery and tragedy. Recovery from childhood pneumonia begins once effective treatment has started, antibiotics for bacterial pneumonia or supportive care for viral cases. Most children start improving within 3 to 5 days, with fever dropping and breathing becoming easier. Cough and tiredness, however, can linger for 2 to 3 weeks as the lungs gradually heal. In severe cases, full recovery may take up to 6 weeks, especially if the child needed oxygen or hospital care. Good nutrition, plenty of fluids, rest, and follow-up visits with a doctor are vital to ensure the lungs return to normal. Parents should watch closely. If cough or breathing problems worsen again, it may signal a complication or reinfection. With timely care and proper recovery support, most children regain full strength and lung function. Not every case of cough and fever needs the emergency room, but knowing when to act fast can save a child's life. Go to a clinic if your child has mild symptoms, like a cough, runny nose, low fever, or mild breathing changes. Doctors there can examine, diagnose, and start treatment early. But head straight to the emergency department if warning signs appear: very fast or labored breathing, chest retractions, wheezing, lips or fingertips turning blue, persistent high fever, inability to drink or feed, or unusual sleepiness. These are signs the lungs are struggling to deliver oxygen and urgent hospital care is needed. In short, mild symptoms, go to clinic; severe breathing difficulty or blue lips, rush to emergency. Acting quickly makes all the difference. When you bring a child with cough, fever, or breathing problems to the clinic, the doctor begins with a careful physical exam. They listen to the chest using a stethoscope, checking for crackling sounds, wheezing, or reduced breath sounds that suggest infection in the lungs. The child's breathing rate and effort are also assessed. Fast breathing or chest retractions are important warning signs. Next, oxygen levels are checked using a small device called a pulse oximeter, placed on the finger. This painless test shows how much oxygen is circulating in the blood, helping the doctor decide if extra oxygen is needed. If pneumonia is suspected, a chest X-ray may be ordered. This imaging shows areas of the lung that are filled with fluid or pus, confirming the diagnosis and ruling out other conditions like asthma or tuberculosis. In some cases, a blood test may also be done to check for infection. Once the type and severity of pneumonia are clear, treatment begins immediately. If bacterial pneumonia is likely, the doctor prescribes antibiotics. If the child is very unwell, they may be given the first dose right in the clinic. Viral pneumonia doesn't need antibiotics, but supportive care, like fluids, fever medicine, and rest, is emphasized. In more serious cases, the child may be referred to a hospital for oxygen therapy or intravenous treatment. The clinic also advises parents on home care, warning signs to watch for, and the importance of completing the full course of medicine. In short, a clinic visit provides diagnosis, oxygen assessment, essential treatment, and guidance, steps that can turn pneumonia from a life-threatening illness into a fully recoverable one. Follow-up visits after pneumonia are just as important as the first treatment. Even when a child looks better, the lungs may still be healing. At follow-up, the doctor checks breathing, listens to the chest, and makes sure oxygen levels are back to normal. They confirm the infection has cleared and that the antibiotics, if prescribed, were effective. Follow-up also helps catch complications, like lingering fluid, wheezing, or a repeat infection, before they become serious. For children who had severe pneumonia, these visits ensure the lungs regain full strength and growth is not affected. Skipping follow-up can mean missing silent problems that only appear later. Simply put, follow-up visits give reassurance, track recovery, and protect your child's future lung health. One of the most powerful ways to prevent childhood pneumonia is through vaccination. Certain germs, like Haemophilus influenza type B, HIV, and pneumococcus, are among the leading causes of severe pneumonia. The HIV vaccine and pneumococcal vaccine protect children by training the immune system to recognize and fight these bacteria before they cause serious lung infections. In countries where these vaccines are widely used, deaths from pneumonia have dropped dramatically. Other routine vaccines, such as measles and whooping cough, also indirectly prevent pneumonia by stopping infections that can spread to the lungs. The key is timing. Children need to receive these vaccines on schedule, starting in the first year of life, to build strong protection. Vaccination is safe, effective, and saves millions of young lives every year. Simply put, keeping up with vaccines is one of the best defenses a parent can give against pneumonia. Simple daily habits can greatly reduce a child's risk of pneumonia. Hand washing with soap is one of the most effective defenses. Germs that cause pneumonia often spread through touch, from sneezing, coughing, or contaminated surfaces. Teaching children and caregivers to wash hands before eating, after using the toilet, and after coughing can stop these germs before they reach the lungs. Another major factor is smoke exposure. Smoke from cigarettes or cooking fires weakens the lungs, damages tiny airways, and makes children far more vulnerable to infections. A smoke-free home and proper ventilation during cooking protect delicate lungs from irritation and infection. Together, these simple steps, clean hands and clean air, build a strong shield against pneumonia and keep children breathing freely. Breastfeeding is one of the most powerful natural protections against pneumonia in infants and young children. Breast milk is rich in antibodies and immune-boosting cells that help babies fight off bacteria and viruses before they settle in the lungs. Exclusive breastfeeding for the first 6 months greatly reduces the risk of pneumonia and other infections, because babies receive complete nutrition and powerful immune defense in every feed. For children recovering from pneumonia, breastfeeding continues to provide strength, hydration, and comfort, helping them heal faster and avoid complications. It also lowers the chances of repeat infections by strengthening the body's defenses long-term. In short, breastfeeding is not only food, it's medicine from a mother's body, giving children a stronger shield against pneumonia and a healthier start to life. A strong body fights pneumonia more effectively, and that strength comes from good nutrition and proper hydration. Children who eat a balanced diet, rich in fruits, vegetables, grains, protein, and healthy fats, get the vitamins and minerals their immune systems need to resist infection. Nutrients like vitamin A, vitamin C, zinc, and iron help white blood cells work efficiently against the germs that cause pneumonia. During recovery, good nutrition speeds healing, restores energy, and repairs damaged lung tissue. Hydration is just as vital. Plenty of fluids keep mucus thin, making it easier for the lungs to clear. Even simple soups, clean water, and oral rehydration help prevent dehydration from fever and fast breathing. In short, nourishing food and adequate fluids are not just fuel, they're powerful medicine for both preventing and overcoming pneumonia. Caring for a child at home after pneumonia is about supporting healing and preventing relapse. First, ensure they take all medicines exactly as prescribed, especially antibiotics, which must be completed even if the child looks better. Encourage plenty of rest, because the body needs energy to repair the lungs. Good nutrition and hydration are essential. Offer balanced meals, fruits, and lots of fluids to keep the body strong and mucus thin. Keep the home smoke-free and well ventilated so the lungs can recover in clean air. Monitor breathing closely. If cough or fever worsen, or if the child has fast or difficult breathing again, seek medical help immediately. Finally, don't miss follow-up visits with the doctor. With the right home care, children not only recover fully but also regain their energy and strength faster. Many people believe pneumonia only strikes in cold weather, but that's a dangerous myth. Take the story of Amir, a 3-year-old from a hot, tropical town. In the middle of a warm, sunny season, he developed a cough and fever that quickly worsened into fast breathing. At the clinic, doctors diagnosed pneumonia caused by bacteria, not the weather. In fact, pneumonia can happen anywhere, anytime, because it's caused by germs, not temperature. While cold air may irritate the lungs, the true triggers are bacteria, viruses, weak immunity, and environmental risks like smoke or malnutrition. Amir recovered well with timely antibiotics, but his story reminds us, pneumonia doesn't wait for winter. It can strike a child in any climate, so awareness and prevention matter all year round. Myth 1: Antibiotics can treat all coughs. Sarah, a 2-year-old, came to the clinic with a runny nose, mild cough, and low fever. Her parents insisted on antibiotics, believing it would cure the cough. But the doctor explained it was a viral infection, not bacteria. Antibiotics would do nothing, except cause side effects or resistance in the future. Instead, Sarah was treated with rest, fluids, and fever medicine, and she recovered fully in a few days. This shows not every cough needs antibiotics, only bacterial infections do. Using antibiotics unnecessarily can make them useless when truly needed. The right treatment starts with the right diagnosis. Myth 2: It will go away on its own. Adam, a 4-year-old, had a worsening cough and fever. His parents thought it was just a cold and delayed seeking care, believing it would clear up by itself. But within days, Adam developed severe breathing difficulty and had to be rushed to the hospital, where he was diagnosed with pneumonia. Thankfully, he survived after urgent oxygen and antibiotics. His story shows that not all coughs are harmless, some can quickly turn into life-threatening pneumonia. Waiting too long is risky. Early checkups save lives. Before we close, let's quickly recap the most important action points. First, recognize signs early. Cough, fever, and fast breathing should never be ignored. Second, seek medical help immediately if severe signs appear, such as chest retractions, bluish lips, or unusual sleepiness. Third, prevention is powerful. Vaccines, breastfeeding, good nutrition, handwashing, and a smoke-free home all protect children from pneumonia. Finally, remember that community and clinic partnership saves lives. Parents, families, and healthcare providers working together can stop pneumonia before it becomes deadly. Knowledge, action, and care, that's the path to healthier children everywhere. When visiting the doctor for a child with pneumonia, parents should pay close attention to key markers discussed during the consultation. First are clinical detection markers, such as cough, fever, and breathing rate, that help confirm the illness. Next are severity markers, like chest retractions, fast breathing, or low oxygen, that show how serious the condition is. Finally, listen carefully when the doctor explains treatment and prevention steps, including medicines, follow-up visits, vaccines, and home care. Many parents miss important details simply because the terms sound unfamiliar. That's why it's equally important to understand the main glossary of medical words commonly used, so nothing is misunderstood or overlooked. Listening for these markers and clarifying terms ensures children get the best care and parents leave with clear, confident knowledge. When visiting the doctor for a child with pneumonia, parents should pay close attention to key markers discussed during the consultation. First are clinical detection markers, such as cough, fever, and breathing rate, that help confirm the illness. Next are severity markers, like chest retractions, fast breathing, or low oxygen, that show how serious the condition is. Finally, listen carefully when the doctor explains treatment and prevention steps, including medicines, follow-up visits, vaccines, and home care. Many parents miss important details simply because the terms sound unfamiliar. That's why it's equally important to understand the main glossary of medical words commonly used, so nothing is misunderstood or overlooked. Listening for these markers and clarifying terms ensures children get the best care and parents leave with clear, confident knowledge. When visiting the doctor for a child with pneumonia, parents should pay close attention to key markers discussed during the consultation. First are clinical detection markers, such as cough, fever, and breathing rate, that help confirm the illness. Next are severity markers, like chest retractions, fast breathing, or low oxygen, that show how serious the condition is. Finally, listen carefully when the doctor explains treatment and prevention steps, including medicines, follow-up visits, vaccines, and home care. Many parents miss important details simply because the terms sound unfamiliar. That's why it's equally important to understand the main glossary of medical words commonly used, so nothing is misunderstood or overlooked. Listening for these markers and clarifying terms ensures children get the best care and parents leave with clear, confident knowledge.